Okay, y'all, the reading this week had us look at several different um, populations or issues for couples therapy, but we're just going to look at one of them in this video, this presentation. So I just encourage you guys to engage with the reading in the textbook so you can understand sort of the process for engaging in couples therapy for other situations and issues as well. So let's look at couples therapy for partner aggression. Okay, so what is partner aggression? It's also known as intimate partner violence, IPV, and IPV is any form of physical aggression towards a romantic partner. And you know what? It cuts through all races, socioeconomic classes, um, religions, ethnicities, age groups. I see it, I have several women of my clients that are in intimate partner violence relationships. And, um, so many of the time we hear people say, oh, they can't get out of the relationship because their abuser is the breadwinner, whatever in the relationship. Yes, that's the case in some scenarios, but with the women that I see, all of them are perfectly financially capable of their own. In fact, one is I was going to say a multimillionaire, but she is probably a billionaire at this point, has her own company, which she created from the ground up, and is in a relationship with a boyfriend that is violent and abusive. And so, so really that cycle of violence, when we hear about it, it's not because they're dependent on the person, the abuser financially, but they get caught up in this pattern. It's almost like, when we think of addiction, it's kind of the highs and the lows, but it also goes deeper than that. And we'll talk a little bit about that in just a minute. But for now, just know that intimate partner violence, again, just cuts through all demographic groups. So, what are the risk factors for IPV? Oh, there are so many risk factors. In your book, the textbook lists some of them, relationship dissatisfaction. But it's important to realize that sometimes abusers are going to abuse regardless of, that relationship dissatisfaction or, whatever it is. But because of, what I see more commonly is that it's a learned behavior. So, the abuser learns to abuse from what he sees, or she, in some instances, sees from childhood. He or she may have been exposed to intimate partner violence, may have been abused themselves. But I, have worked with I was going to say a young man, he's in his 40s, so middle-aged man who is violent and abusive. And he, grew up in a family that was the same way. His father pummeled his mother to the point where she was in the hospital nearly dead. But he went on to engage in those same behaviors despite the fears and the feelings he had as a child. So it's really, he saw that as a means for exerting his control in a family that was very patriarchal, and so it was almost like he saw that as his obligation and his role and his responsibility. So trying to almost teach him otherwise is like uprooting or unrooting all those deeply held beliefs. So there's so much that goes into it. And even women that find themselves in those relationships, a lot of times they say, I don't know how I ended up in this relationship. I could have never imagined myself in this relationship. Actually, what I see is the women that find themselves in those relationships generally have very similar traits, and those include they are caretakers. They are very trusting of people, too trusting. They're extremely loyal. They're easily manipulated by guilt, anger, fear. They are also easily manipulated by charm. They're very nice, very friendly to people. They also have low self esteem. They may have been abused as a child, which creates this idea that that they tend to equate physical violence with love. And so it's almost like that whole sense of that's comfortable for them because it's what they know. So there's some actual personality traits that are risk factors for becoming engaged in some sort of IPV type relationship. Some other risk factors for IPV obviously includes certain, gender roles, culture. Some cultures are more susceptible or where it's practiced and it's more accepted in different cultures. Also, psychopathology. So, if there's an underlying mental illness, it does increase the risk for either being a victim or being the abuser. For instance, substance use disorder increases the risk for being a victim and for being the abuser. Um, so I would also say that there are personality disorders. And in our extreme cases of IPV, I'm not saying this is with every case, we see the abuser, and he might have some traits of antisocial personality disorder, what is, in pop psychology known as psychopathology. And I had one person, an abuser, tell me that he preys on women who have certain personality traits, and those are the traits that we talked about before. But he seemed to say this with such pride and excitement, and so there's that. Those that have the personality disorders, such as obviously antisocial personality disorder and narcissistic personality disorder, are definitely harder to treat. Individually and in a couple situation, because again, remember some of the characteristics of individuals with those two personality disorders is that they blame others for their problems. They are unable to introspect or to look at themselves and take responsibility for their actions. They can lie pathologically. So it's very difficult to work with certain types of abusers. So there are several goals of couples therapy for partner aggression. Obviously, the overarching goal is to, reduce the violence, but modifying partners' interactions with each other. Because in doing so, then the hope and the goal is to reduce violence. So the therapist's role in couples therapy with intimate partner violence is really a very hands-on, kind of a consultant teacher type of role, because there's a lot of psychoeducation that's going to be going on. We're going to be doing a lot of teaching in the process of therapy with this couple. We take a strength-based perspective. We don't want to just hone in on the abuse, but we want to identify some of the strengths. And we want to make sure that we demonstrate empathy towards both partners, which sometimes can be difficult, especially when we find ourselves aligning with, the victim. We find ourselves kind of enraged towards this violent partner. So we really have to kind of rein in on those feelings that we might have and recognize those feelings. But it's so important to really demonstrate this empathy towards both partners. And we also want to be cautious about aligning. We don't want to align with one partner of the other. We help the partners identify positive qualities. And so this is, help them, you know, identify those positive qualities that actually attracted them to each other initially. Recall the dreams for a fulfilling relationship, um, and help them recognize the importance of committing themselves to reducing these negative interactions. So, so the therapist plays just a number of more roles, and I would say the therapist in this situation is mildly to moderately directive. Um, so we take a more active role, but it's more directive. Um, we also, as I mentioned earlier, we demonstrate that unconditional positive regard. We don't judge the person for their behaviors, which sometimes is hard not to do. But so we want to focus on what can we do differently? How can we change? What can we do to have a fulfilling relationship? Okay, just as we talked about last week, assessment is really important here. It's important in any type of couples therapy. We always want to do an assessment. It's really important to realize and remember that assessment drives our interventions. So, couples therapy should never proceed without thorough screening and assessment. We also, first of all, safety first. When you're working with a couple that has some intimate partner violence going on, we want to make sure that our clients are safe. So this is really important to remember and recognize. If we see that they are not safe, we want to do some safety planning. We want to make sure that they're in a safe place, and whatever that's going to look like is going to depend on what's going on in the situation. But also, and here's just one of the things that I do want to highlight, because I don't know that it was highlighted in the text fic. I've had clients come to me. I've been working, when I work with couples, one will come in, or one will call, or one will show up with bruises. So it's really important to address this from an ethical perspective. What do we do? Do we call the police? Do we break confidentiality and to report this IPV? No. In most states, you do not. And in fact, doing so could be a breach of confidentiality that could actually land you in some legal hot water. So, okay, so then that begs the question, but don't we want to protect? Isn't that our role, to protect? It is, but here's the thing. If we reported intimate partner violence, we are taking away that woman's voice, or that man's voice, whoever was being abused, because they are an adult and they're capable of reporting. Okay, so these are adults. This is different than working with kids or the elderly population, but these are adults. Also, if we call and report, guess what? We are putting that person at even greater risk for violence. And chances are this person, the one that's being abused, probably will never come back to therapy again. Because why? Because her trust was violated. And now she knows that she can never talk openly and honestly about the abuse. So really, our goal, especially when we have an individual coming to us, our goal is to equip and to empower the person that is being abused. We empower them to have their voice. So in couples therapy, this does look a little different, but we always want to assess for safety. If we discern or decide that there is too much violence, or we might even be putting ourselves at risk, then we do not do the couples session. So we can conduct also separate intake sessions. So that means that we meet with each individual partner, and we take a history, we assess for safety, all that kind of stuff. We screen for fear, coercion, and We might even use some assessment tools in that process. We develop a safety plan before we even consider doing conjoint therapy. So that safety plan is going to look different with each client or couple that you have. But basically, it might look something like, what will you do when violence does happen? And I also stipulate that that there cannot be any violence. If I will say if there's two incidents is too many, and I will not see them any longer. So you have to, as a counselor, set those boundaries and set those expectations for the clients. Hold them accountable. Um, so so these are it's just this is important in the whole couples therapy with IPV, is those assessments are critical. Again, as I mentioned previously, a lot of what we do in couples therapy with IPV is psychoeducation, almost from like a cognitive behavioral therapy approach. Um, but we're doing a lot of teaching. We're teaching them how to interact with each other. We're teaching them how to regulate their emotions. We're teaching them how to resolve conflict. Um, so some of the interventions, simple, teach them how to do a timeout. When couples start to escalate, become angry, the therapist helps guide them in using a timeout. And they have an agreement. Okay, this is what we're going to do when things get escalated. We are going to go to separate parts of the house, or, one spouse might go, or one, partner might go on a walk through the neighborhood. But what's important is they take that space, they take that time out, because that togetherness is fueling aggression. So it's time to just take a step away and then come back later and talk about the situation more constructively and without the heightened emotions. So, and part of that is just, doing that communication skills training. It's learning how to teach them, or learning how to listen. So we're going to teach them how to listen attentively, how to respond, and how, what words to use, and the tone of voice. So again, remember, a lot of this is just kind of your basic psychoeducational skills training. We're going to teach them how to problem solve. Uh, so we're going to modify their cognitions. And again, as I mentioned earlier, we're going to teach them how to regulate their emotions. So there's a lot that goes into this. And like I said, a lot of it is psychoeducational.